You have taken the AstraZeneca vaccine. You've been championing Bahamians to ensure that they take this vaccine as soon as it arrives. How do you feel now?
I feel great. Well, I guess even as a physician, all my colleagues would know that I am afraid of needles. And to be honest, I didn't even feel it. And so individuals who are even afraid of needles, they need not worry because you cannot feel it. But I look forward to the entire Bahamas receiving the vaccine because our great priority at this particular time is safety and ensuring that all of our population, all our Bahamians, residents, and those within the Bahamas are safe so that we can go back to work, commence our regular life, and can socialize. That is a part of our culture. We are not a group of people who are accustomed to elbow and not social distancing. So I think we'd be more than happy to get back to normal life as quickly as possible.
Unfortunately, sir, there are some people who still are on the fence about taking the vaccine. Why would you pitch a message or sell to them that they need to take this as soon as they can?
I think it's essential. There have been a lot of fake news and rumors about side effects and different things. But you'd notice that millions and millions of individuals throughout the world have already been vaccinated and there have not been any difficulty or problems. And that speaks volumes. I have taken mine. There was no fear or anything. And I advise the Bahamian population to take the vaccine also so that our country can get back to normal as quickly as possible. Individuals can start working. Our kids can get back to school. Individuals can start playing. Our athletes can get back to practicing. We can prepare for Olympics, etc. And it's essential for us to get especially our family islands back to normal and advancing them as quickly as possible.
How confident are you that we can get the majority of the population vaccinated?
I think what is amazing, as soon as individuals had heard that I and others were being vaccinated, I was amused by the amount of phone calls that I received at home. Individuals who were calling, and everywhere I stopped. I went to the supermarket this morning shopping, and people were stopping me asking when can they get the vaccine. They want the vaccine. So I think we're turning the corner now. Lots of Bahamians are now, they're understanding and they recognize that the vaccine is it's safe and it will save lives, and that has been our real mantra, saving lives and getting us back to work.
Can you tell us what's the next step? We see that the pilot program is being rolled out. Can you tell us how many people are expected to be vaccinated today? And then can you tell us about the healthcare workers and the non-ambulatory people?
Well, there's a committee. There's a committee that's in charge of that. And that committee was responsible for the entire rollout. There was no political involvement. They would have announced previously that they have a program with healthcare workers or first-line defenders first, and then dealing with elder care individuals within the homes, inclusive of those who are caring for them and those who are within hospital facility. Occasionally they may just tweak it, but the committee deals with that. There's no political involvement, no politicians involved. So they would speak to that.
You can't speak to what the next.
No, the committee would speak to that.
But I mean, overseeing the committee, shouldn't you be able to say what's next?
No, I think the committee goes through the process. They go through their protocol, and from time to time they may tweak things. And when they tweak things, but there's still a committee who is responsible, Travis, not I. Next question.
Personally, what are you most looking forward to after getting your shot?
Well, from here, I'm going to church. I'm at a church service, and I'll be speaking there in about another hour or so. So I'll be there. But what I am looking forward to is for us receiving the remainder of the vaccines so that our entire population can be rolled out as quickly as possible. I would like to see our entire populace back to normal May, June, so that we can commence whatever things we've done in the past.
Is there a concern that there may be a shortage of vaccines in terms of some persons, there may not be enough in country for persons to get their second dose?
Well, that's what I just said. We have 20,000 now. We'd use that on 20,000 individuals. We have another 33,000 on its way. And then we'd have the remainder coming from the COVAX. And we are aggressively pursuing other sources so that we can continue to roll out and get back to normal as quickly as possible. Thank you very much. You all enjoy the rest.